Podcast 9 of the Upper Limb series, the Carpal Tunnel. This podcast is going to detail the boundaries and contents of the carpal tunnel. So the carpal tunnel is a fibro-osseous passageway that allows structures to pass between the forearm and the hand. Its floor is formed by the two rows of carpal bones that form a deep arch, and its roof is the flexor retinaculum. The flexor retinaculum is a tough band of connective tissue that connects the two sides of the carpal arch. Medially, it attaches to the pisiform and the hook of the hamate, and laterally, it attaches to the tubercles of the scaphoid and trapezium bones. Running through the carpal tunnel are the 8 individual tendons of flexor digitorum superficialis and profundus, and also running through the carpal tunnel is the tendon of flexor pollicis longus and the median nerve. The structures that pass through the carpal tunnel have a very specific order. If you remember from podcast 7, when I detailed the anterior compartment of the forearm, then the two flexor digitorum muscles, superficialis and profundus, extend from the forearm to the digits, and flexor digitorum superficialis is superficial to flexor digitorum profundus. Well, this order is maintained in the carpal tunnel, so that immediately deep to the flexor retinaculum are the 4 flexor digitorum superficialis tendons, and deep to these are the 4 tendons of flexor digitorum profundus. Lying lateral to these 8 tendons, but still within the carpal tunnel, is the tendon of flexor pollicis longus that's going towards the thumb. Functionally, the carpal tunnel has an important role in allowing the efficient transfer of power from the muscles to the respective bones. It does this by preventing the tendons from splaying with forceful contraction. Running alongside the 9 tendons within the carpal tunnel is the median nerve. The median nerve is the most superficial structure within the carpal tunnel and is positioned between the flexor retinaculum and the tendons of flexor digitorum superficialis. The positioning of the median nerve in between the tough flexor retinaculum and these tendons make it vulnerable to compression if the carpal tunnel is reduced in size. The carpal tunnel can narrow due to numerous reasons, including fluid retention and infection of the tendons, or excessive use of the fingers, which could lead to inflammation of the surrounding synovial sheaths. A narrowing of the carpal tunnel can compress the median nerve against the flexor retinaculum, resulting in a loss of sensory function, i.e. paresthesia, diminished sensation or anesthesia, occurring along the lateral 3.5 fingers. Sustained compression can also lead to both muscle weakness and an inability to oppose the thumb. Lying superficial to the flexor retinaculum is the tendon of palmaris longus. This tendon doesn't enter the carpal tunnel and attaches to the palmar aponeurosis of the hand. Also running superficially and not passing through the carpal tunnel is the ulnar nerve and artery. These structures extend along the medial aspect of the wrist and pass into the hand through a connective tissue sheath known as the ulnar tunnel or canal of Guyon. So to end this podcast, I just want to give some brief details about the extensor retinaculum, which is located on the posterior surface of the wrist, and like the flexor retinaculum, prevents the extensor tendons from splaying either side of the wrist during rigorous contraction. This band of tough connective tissue runs obliquely from the distal radius to the triquetral and pisiform carpal bones, and it creates 6 osseofibrous tunnels. These 6 osseofibrous tunnels allow the 12 tendons of the 9 extensor muscles to pass from the forearm into the hand. The tendons of abductor pollicis longus and brevis pass through the first tunnel, which is medial. Then moving laterally, the second tunnel allows the 2 extensor carpi radialis tendons to pass through. The third tunnel allows extensor pollicis longus. The fourth tunnel allows extensor digitorum and extensor indices. The 5th tunnel allows extensor digiti minimi, and the 6th tunnel allows extensor carpi ulnaris. So in this podcast, I've detailed the boundaries and contents of the carpal tunnel, and finish by detailing the extensor retinaculum. In the next podcast, number 10, I will detail the muscles of the hand.